First of all, we are going to talk about what happens to the body during pregnancy, what is contributing to the mommy tummy. When I say mommy tummy, you remember how before we had kids, how our stomach looked when we got bloated, or even if we gained weight. It was kind of a generalized getting bigger, right? But now that we've had babies and our tummy has stretched out in different formations, when we get bloated or we gain weight, we often come and take on this look of pregnancy, even when we're not pregnant. If you know what I'm talking about, definitely say me in the comments. Like for me, before I had babies, when I got bloated, it was just a generalized bloating. But now when I get bloated, I can look like a few months pregnant, you know? And so it's just because of how our stretching happened. And that's what I'm going to talk a little bit about right now. When you get pregnant, all of this stuff stretches out, right? So the baby comes in and stretches us all out this way. Not only do our muscles and our connective tissue that connects the muscles together get stretched out, but even our ribs flare to make space for the baby. So when the baby is pushing up, the ribs kind of start to come out to accommodate all of that. I mean, the organs and everything get pushed around. All of that is getting stretched out, flared out, okay? So that happens during pregnancy. Another thing that happens during pregnancy, we'll get back to the rib flare in a little bit more detail after I explain a couple of other things that are contributing to the mommy tummy, because it's really important that we understand what's contributing to it so that you know how to fix it or to strengthen it. Let me not say fix it, but to strengthen and tighten, because traditional ab exercises just don't work for this. And I know because I tried them. I was doing all the right exercises that you find on YouTube to snatch your stomach back, but they don't really work if you're not addressing the deeper issues that are going on. Like if you have rib flare, there's certain things that you would want to do. If you have diastasis recti, there's certain things you want to do. You have more than one layer of abdominal muscle, and you want to make sure that you're training the ones that are weaker and that you're making sure you're balancing those muscles with each other, okay? And I'm going to get into it just a little bit more so you understand what I'm talking about. Feel free to ask some questions here in the comments. If I don't get to your question, please message me, whether it's in TikTok, I'd say Instagram, probably a little bit quicker to answer, or message me in Facebook, wherever. But message me personally, we'll get back to you eventually. But I usually get back to every single person in a matter of time. All right, so diastasis recti, I've thrown that word out a couple times. Let me explain what that is before I go into the rib flare talk. Diastasis recti is separation of the abdominal wall. So it's not like an actual separation. It's more of a thinning or stretching of this midline tissue. So you see here I have muscles. This is my rectus abdominis, or my six-pack muscles. And during pregnancy, like I said, this stretches out, right? This midline tissue that connects the muscles together is connective tissue. It connects everything in the body, okay? It's connecting the muscles. That midline tissue stretches or separates and becomes something wider like this or like this, okay? Diastasis recti is a very common condition. 1 out of 3 moms will have this postpartum. Still, it won't resolve itself. 2 out of 3 moms, it will naturally resolve on its own. 100% of moms get diastasis recti during pregnancy, especially if they're into the 3rd trimester, because that's when the baby gets really big. It's totally natural, totally normal. It's unavoidable. What you can avoid is having it get too stretched during pregnancy, because it only needs to stretch so far. This is just the body's way of allowing your body to stretch to accommodate the baby, okay? So you get that separation there. It's called diastasis recti. I'm telling you this because I didn't know anything about diastasis recti. I mean, I was literally working with first-time moms in a clinical setting, and I never heard of the term. And I worked in the fitness field as well, never heard of the term. So I'm just explaining this to you so you know what it is. It's nothing to be afraid of. It's just something you want to be aware of so that you can treat your body properly postpartum and you can get the healing. That could be why, let's say that you've done a bunch of traditional ab exercises and they didn't work. Your tummy, you still feel like you're not strong in your core. It might be because you weren't doing something that really would help that diastasis recti. You might have been doing something that could even kind of make it worse. So how do you know if you have this? Very quickly with me, I want you to do this really quick test. I have a more in-depth test. If you check the link in my bio, there's a more in-depth test, but a really quick one is Wherever you are, you can lean back. You can be standing or sitting. I want you to lean back. Don't actually touch anything, but lean back and look down. Do you see any bulging coming up through the midline? You see that? Bulging coming up through the midline. If you see that, like coning or doming coming up through, that's diastasis recti. If you see that, put me in the comments, okay? Put me in the comments. I know you guys are like, people are coming on here freaking out like, what is going on with this outfit? Okay, I'm not here trying to be funny. I really am teaching here, so stick with me. Okay, I see Bethany said me, Megan said me, Big Me from Love Yourself 2235. So yes, you guys are seeing that. That is diastasis recti. Okay, so that's the stretched out tissue here. See how it was before baby? After baby, that can get stretched out, and this tissue here is a little bit thinner than it was before. So when you lean back and you look down, you're seeing the pressure is coming through the weakest part of your core, and that's here, okay? Now, one thing I want to say before I go on to the rib flare talk is when you are doing exercises, whatever exercises you're doing, whether they say core, for your mommy tummy, or whatever, if you're doing an exercise and you see excessive doming or coning coming up through your midline, I want you to back off of that exercise. Okay, I want you to back off of that exercise, because what's happening here is you see this, like I said, it's a kind of a stretched out, thinner, it's thinner than it was before. When you're leaning back, you're pushing through this area. And if you push it to the point where it's firm and it feels firm to the touch, then you're kind of pushing it to its limit. And what you don't want to do is you don't want to keep pushing it at its limit. You don't want it to get worse than it already is. If you also have an umbilical hernia or something like that, you also want to be mindful of seeing this coning or doming or having that pushing through the midline. You want to go back and reevaluate what you're doing. Go through my videos. The videos I have are ideally safer for those of us with diastasis recti or who are needing more deep core strength. And we can talk about that next week. But I just want to drop that little tidbit before I move on. If you don't know what I'm talking about, check out my old videos on YouTube, especially the longer ones where there are my lives from TikTok, because I go into more depth about that. But I just want to drop that tip right here and let you know that that could be why you haven't seen the progress you were hoping for with traditional ab exercises. Because what does this exercise mimic? So you lean back, you see that coning and doming. If it's firm, it's like really excessively pushing out. Like if you see a little bit of coning and doming when you're doing an exercise, you don't have to be afraid of that. But if it's excessive and it feels hard, like you're pushing it to its limit, that's what you need to be leery of, okay? When you see that, you want to just back off of that exercise. That's something like a very common exercise that you see for abs. What is that? It's like doing a sit-up. Okay, so people will say, yeah, do 100 sit-ups, do all these sit-ups to get our stomachs tight again. But that's the very motion that if you have diastasis recti, you could be causing some issues there. So we want to work up to a sit-up, okay? That's why in a lot of my TikToks you'll see, stop doing sit-ups, do these instead. It's not that you can never do one, but if you see excessive doming when you are doing one, you're not ready for that, and you could be making your situation worse. Yes, if you have I see somebody said, I also have an umbilical hernia. If you have an umbilical hernia, that's something that you want to make sure you're strong enough for, like a sit-up or a V-sit or something like that. You want to make sure you're strong enough for that before you start going into those things. Okay, I only have a few more minutes left, and I promised I was going to talk about rib flare. Okay, this is a really popular topic because when we are pregnant, the baby is there. I wish I had like a stuffed animal or something. My kids usually have stuff around. Probably on my bed. Nope, nothing under my bed. Okay, so just pretend I have a baby in there. I should have put on my other suit. Then y'all would have really been cracking up. Okay, let me just pull it out just to kind of give you an idea. This is why I have all these suits, because I just am such a visual person. All right, so pretend I have on this suit too, all right? So when the baby is down here, starting out, then the baby grows up, right? All these organs are still present and they're still needed. So they're being pushed all around to and up, right? What's up there? We have ribs. All right, so our ribs are there, and it's like, oh, not a lot of space, so your ribs get wider. I'm sure a lot of you might have gone up some bra sizes when you were pregnant, and you might not have gone all the way back down to pre-baby size. Now, that is a very normal, natural thing to happen, is the rib flare during pregnancy, and even postpartum, it happens, and it doesn't always come back down. And so what do we do about that? Well, one, I want you to assess your ribs to see if you have rib flare. There are two types of rib flare. The first type of rib flare is kind of a lateral flare. So lateral is where it's out to the sides, okay? Lateral is where it's out to the sides. The other one is more where it's just kind of thrusted forward. You see? Where here's my rib cage like this. When I go forward, it makes it a bit wider because I'm flaring it forward. So there's forward rib flare and there's lateral out to the sides. And both of those are things that you want to work on, and people will try to minimize and say, oh, your ribs are fine. You know, it's no big deal. Some people think I'm trying to like pick on people or get people to be an ideal shape or size. That's not it. It really comes down to function. So what's attached to your ribs? You actually have muscles attached to your ribs. So here are muscles. You have your abdominal muscles are actually attached to them. So if your ribs are actually flared out this way, then your external obliques, let me just show you. You have your external obliques are connected there at the base of your ribs, and they come down this way. And so your external obliques actually help pull them back in, and that's the muscle that helps to move you this way, okay? You're kind of crisscrossing that way. So if your external obliques had to kind of give way because the baby was pushing up, postpartum, if you still have that flare out to the side, then your external obliques are one of the muscles that are really going to probably need a little bit of work, okay? How do you know if you have a lateral rib flare? Okay, here's a way to test that's pretty simple, like a simple way to do it. I just grab a book. Books that are usually have a 90-degree angle. You should be roundabout at a 90-degree angle, okay? You should be roundabout at a 90-degree angle. You should try to get a straight line to go down that way. And if your ribs are wider than a 90-degree angle, then you have a lateral rib flare. Some people may have just more on one side. Now, if you have slightly more on one side, it's okay because you have different organs on the different sides. I won't pull up my organs soon because I got to go soon. But if it's quite a bit wider than 90 degrees, then you're going to want to really work on bringing that down. In my link in my bio, I have a whole rib flare playlist with exercises and like different tips and different things I've said about rib flare specifically. So definitely check that out. But what was I going to say? Yeah, rib flare. That's lateral rib flare, okay? So lateral rib flare is where it's wider than 90 degrees, okay? So when people are trying to kind of like bash me and say, well, don't make people self-conscious about this, yada, 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 I'm like, okay, it's not about self-conscious. So what are some of the issues that can happen if you have a wider rib flare? Okay, so if you have a wider rib flare, you can have issues because your core is really connected. The top of your core is your diaphragm. The bottom is your pelvic floor. The sides are your ab muscles going around. Okay, so some people may have pelvic floor issues. You might not feel like you can get really good core engagement because your ribs are flared out to the sides and your external obliques really aren't doing their job. If your core isn't very stable, you could have a very tight back because your back is really trying to help stabilize you because your core isn't able to stabilize you. Like, there are different functional issues. Like, for me, the thing that really got me into these types of exercises and really wanting to tighten and strengthen my core, it wasn't even just aesthetics. Yes, I did have people ask me if I was pregnant. Super embarrassing. But the thing that really got me was I pinched a nerve really badly because my core was so weak and I literally couldn't walk. Like, I one day was sitting on the toilet, I turned around to get the tissue or something, and my back like literally froze and stuck. I could not sit up straight, stand up straight, couldn't hold my baby. I had to have a friend help me, and I went to a chiropractor, physical therapist office. They were all together, and they're like, you have to strengthen your core or you're going to keep having these problems. So it really becomes a functional issue. Let's briefly talk about the other type of rib flare. I'm going to just kind of, oh yeah, see, somebody said, Elena, she said, oh, that happened to me. See, that's why I'm saying this is not just about function. Rib flare it's not just about aesthetics. Rib flare can be a functional issue, because if you don't have good core engagement, then you don't have the back support, the front support, even the pelvic floor support that you need. For those of you who experience leaking issues and things like that, which I also have had to deal with too, like those are all functional issues that we don't have to deal with, and these things are all connected. Okay, very briefly before I jump off, I'm going to talk about the forward rib flare. So if you find that your rib cage is wider than it was before, you wear a wider bra size than you did before baby, but you don't have the lateral flare, you could have a forward rib flare. Tends to be something that you can kind of really work on with just posture, kind of like extending up nice and tall, and just trying to position your rib cage to where it's not pointing forward, but it's pointing down over your pelvis, okay? But what can happen there is your abs might be lax. So here, just pull up this real quick. These muscles here kind of elongate during pregnancy because the baby is hanging out this way, right? So you're going to want to work on those deep core muscles that help bring you back in, especially your deeper core muscles, which we didn't talk about, the different layers. We'll talk about that next time, or check out an old YouTube video of mine, because I talk about the 4 layers of the muscle layers of the stomach, because you have several that have different functions, and you want to see which ones are out of balance or weaker and work on those, okay? But working on those elongated muscles and tightening those up can help bring that back into balance, because sometimes especially your lower transverse abdominis that helps, stabilize your core, sometimes those just shut down during pregnancy because it has to expand for the baby, right? But we need to turn them back on, and that kind of helps rotate things, properly. So a tip for that, really try to focus on elongating up nice and tall, making sure your ribs are pointing down towards your pelvis, not flaring forward. So that just takes practice and also strengthening those muscles. Check